So, hello everyone. In this lesson, we'll be talking about myxomatous mitral valve disease. Mitral valve disease is the most common cardiac disease in dogs, being estimated to account for 75 to 80% of all cardiac diseases. The mitral valve is one of the four heart valves located between the left atrium and ventricle, and it is responsible for allowing the blood to flow from the atrium to the ventricle so that it can then continue its path to the body. Mitral valve disease is characterized by a progressive degeneration of the mitral valve with consequent left atrial and ventricular dilation. It is seen more frequently in small dogs such as Cavalier King Charles Spaniel, Dachshunds, Poodles, and Yorkshire Terriers. Studies in Cavalier King Charles Spaniel and Dachshunds have found evidence of genetic factors that play a major role in the etiology of this disease, and that is why several breeding programs were launched to reduce the incidence of this disease. Macroscopically, the valve that should be thin, translucent, and soft becomes gradually thickened and irregular. The distortion of the architecture of the valve leads to an abnormal coaptation of the mitral valve leaflets, and for that reason, whenever there's a systole, part of the body or part of the blood is ejected backwards, and this blood that is ejected backwards is responsible for the heart murmur that we hear on auscultation. So there are four stages of the mitral valve disease, and usually the stages A and B are not associated with clinical signs. These dogs usually only have heart murmur heard at auscultation. When in stages C and D, dogs may start presenting several clinical signs, so cough and respiratory distress as tachypnea and dyspnea due to an increased left atrium and pulmonary pressure. In the cases where there's pulmonary hypertension, the congestion and edema that originate lead to an increased respiratory rate at rest or sleep, usually more than 30 breaths per minute. May have also generalized weakness due to decreased blood flow from ventricles, pleural effusion and ascites due to an increased right atrium and systemic venous pressure, and unfortunately also sudden death because of acute heart decompensation. First, we should, to diagnose this disease, we should, of course, perform a good physical examination. Never forget to auscultate the dog to assess the condition of the heart and also the lungs. Also, see how's the pulse. Is it strong or is it weak? How's the heart rate? Is there any arrhythmia? Then do blood and urine tests to exclude any other disorders. When we find a heart murmur in a dog or even more advanced clinical signs compatible with mitral valve disease, this dog is indicated to do at least an echocardiogram to diagnose mitral valve disease and also to monitor the condition. With this disease, we can see the architecture of the mitral valve, if there's any thickening and prolapse of the mitral valve. It is important also to evaluate the sizes of the left atrium and ventricle. In dogs with severe disease, the structural changes of the heart, the left atrium and the left ventricle have larger diameter. We can also add the colorful Doppler that you can see here in the image to identify the flow direction and to confirm the presence of regurgitation. We can also perform an ECG. So the ECG is of limited use in the case of mitral valve disease, may be normal or show only signs of arrhythmia. Chest X-rays are important to assess the global cardiac size and presence of signs of pulmonary congestion and edema, are also important to exclude other possible causes of the clinical signs. Dogs with mild mitral valve disease usually have a normal heart size and normal lungs, but as the disease progresses, we may start seeing signs of left atrium and ventricular enlargement. For the students, you can investigate if the heart is enlarged with the vertebral heart score that you can see here in the image on the right. For this calculation, you measure the long axis of the heart from the base to the apex, and measure the short axis, the widest part of the heart. Transfer these measurements to the vertebrae starting at T4 and count the number of vertebrae occupied by those axes. Sum these two measurements and you have the VHS. For dogs, a normal VHS is less than 10.5, and anything larger than that is considered abnormal. We can also measure the natriuretic peptides. These help distinguish mild from severe mitral valve disease and dyspnea and cough from primary respiratory disease from dyspnea and cough caused by cardiac disease. So I don't want for this video to be too long, so we'll discuss treatment and prognosis in the following video. And if you have any questions, as always, leave a comment below.